We all know we have a crisis in healthcare in America. People who fall through the cracks all the time are either uninsured or underinsured, meaning that if they do get sick, their insurance, even if they have insurance, may not come through for them, and they can end up bankrupt as a result of additional costs and things over and above what they're already paying for insurance. So part of the saving side is being able to negotiate down drug prices and medical device prices. Every other country around the world negotiates as a bulk purchaser of those items. The larger group you belong to, the better deal you get on these things. And so we could be doing that as a state here in California, or as a country, like other countries do, negotiate down drug prices. Best example is probably our neighbor nearest to the north, which is Canada. People have basic health care in Canada. They pay that in the form of a payroll tax, comes out of their paycheck, and it pays for everyone to have health care in Canada. So that's what we're looking to do. The way I like to look at it is like a, it's not pie in the sky, but it is a pie. It's a healthcare pie. And right now, a third of every dollar, a third of our healthcare pie is going to these out-of-pocket expenses and waste, fraud and abuse, but especially incredible waste of private insurance and big pharma profiteering. We're not talking about extra money, we're just talking about recovering that third of the healthcare pie, healthcare dollar that we currently waste. It requires no additional money, in fact it saves money, and as a result it allows for more services and benefits to people. Things like dental, mental health, long-term care, those things, drug and alcohol addiction problems, are all paid for in a system like a single payer, what we call expanded and improved Medicare for all. Most Canadians will tell you that if they have an urgent medical need, and they seek care, they get the care in a timely manner. When you look at the real data on the subject, they don't wait any longer than we do. In fact, the bottom line is they live longer than we do. If they had to wait too long for things, they would die early. We're the ones dying early, not them. People think that American healthcare is the best in the world. There's no evidence for making that statement. As we rank below all the other industrialized countries in terms of really, verifiable measurements like infant mortality rate, how many of our babies die in the first year of life. We perform much lower than all of those other countries. Maternal mortality, how many of our moms die related to childbirth, prenatal care, postnatal care, and during delivery itself. Not performing up to the standards of the industrialized world in healthcare, which is why we're talking about healthcare as a crisis. Mm-hmm. It's estimated that you could save 1,000 lives, preventable deaths, every million people who don't have insurance. And that's what they figured out in these other industrialized countries. Conservatives in Canada and Britain and all around the world realize that it's a really good deal to have the government take care of all the, at least on the payment side. You hear all those phony ads on TV and radio, and that's what the various corporate interests will throw at people. Will throw them the propaganda, but we know what's true and what isn't. So like those the students in Parkland, we have to be able to say on the healthcare.
We call BS.